in languages here. So buongiorno. So we have people from Italian universities, Canadian universities, local university, and Americans. So it's going to be buongiorno, hello, hi, yeah, and then we have salam, right? And then from Chicago we would just say howdy. So welcome everyone to the session on the impact of debate on knowledge development and academic skills. We have four presenters. We're going to be, and we know that we stand between you and supper. So we have your attention, right? So we'll have four speakers. We're going to have maybe, I don't know if you've timed yourselves. It's going to be, so maybe 15 to 20 minutes. Yeah, and then we'll do the questions at the end, okay? We'll do the questions at the end. We'll... Yeah, so if we could, and I will let you know when we'll pull you off, okay? To begin with, we have Manuele de Conti from the Modena University in Italy. Thank you.
Okay. Thank you very much to be here, and I will talk about this research I decided to develop on personal epistemologies, which bring us to some questions about debate. But we start with this. We probably, almost certainly, consider that debate is an educational activity, because we know debate promote critical thinking, so among other skills, communication skills, public speaking skills, but it promotes also civic attitudes. For example, Roger Reynolds, with a longitudinal analysis, around 11 or 12 years, shown that debaters are more prone to vote, they are more prone to be work as volunteers, and so on. But debate has impacts also on the educational systems, because, for example, the exceptional researches of Mazouk shows that who participate in debate also have a good marks at the end of the school's year. The debates diminish the dropout rate. Debates promote people to enroll in universities, so it has an impact on the system of education. But nonetheless, during the long-standing history of debate, debate faced also critique, and some of this critique is that debate promote a relativistic point of view and an attitude, or a simplistic attitude, which means truth is not important, or we just need to know something, and we do not think that knowledge is something that is acquired with depth research. We can start in an Occidental tradition with, for example, Aristophanes, which say among the just and unjust speech, the unjust speech just is not interested in values. Values are just relatives. It's just interested in victory. Or dissoilogoi, which is speeches from pros and cons, is an expression that do not exist values among people. Or in Middle Ages disputation, many humanists say that debaters just are interested in a win debate and they focus on what is superficial on problems and so on. And even today, we face many teachers that are okay, they consider debate, promoted this kind of issue. Some in Italy talk about a relativistic pathology because debate could promote a relativistic attitude to knowledge. So what I try to do with this work is try to understand if debate foster relativism or foster superficiality or simplism. How did I do this? Well, I found as the concept who helped me to analyze, to research, inquire this aspect, the concept and the framework of personal epistemology. When we talk about personal epistemology, we talk about the way in which we consider knowledge is and is acquired, the process we acquire knowledge. Some of the most important theorists on epistemology are Pierre, but the concept starts to really being defined by William Perry, and then we have many other researchers that work on this. When we talk about personal epistemologies, we talk about the way we consider the way we consider knowledge is and the process we use to acquire it. And these ideas influence our way to relate to people, our way to relate to ourselves too, as Baxter Magolda say. All these researchers consider that the epistemological or the personal epistemology changes through stages, starting from dogmatism to through relativism and arriving to constructivism or evaluativism, the way in which we analyze the proof and the evidence for our statements. And I return back to the other in a short. This concept allows theorists to elaborate many questionnaires. For example, one of the most important is the Aiken-Schomer one, which considers several dimensions of personal epistemologies. I use these questionnaires, which is known as How I Know, Come Conosco, which is an Italian validated questionnaires on personal epistemologies with 19 items, which are contextualized, which means that each item asks on a specific topic, and in this case is the global temperature rising, how students or debaters react on the case each of the 19 items ask them to answer on knowledge, and define 6 different dimensions of personal epistemologies. Skepticism, 2 are on relativism, simplism, dogmatism, and scrupulosity. I used these questionnaires and I submitted these questionnaires with a quantitative post-intervention experimental design to 180 secondary students from 7 different Italian regions. The experimental group was composed by 101 students and the control group of 79 students. The ages of students, the most, the biggest group of students is around 16 and 18 years old, and there is the experience for those who debated were among 1 and 2 years of experience. So what are the results here? We have, I found that not all dimensions were reliable. So, for example, scrupulosity did not meet reliable results, but luckily for relativism and simplism, I had. And what happened from this analysis is that there is no difference between experimental group and the control group, which means that it does not seem that debates are more relativistic or simplistic on knowledge than people that do not participate in debate. And so I can think that for a certain level, we can conclude that debate do not promote this kind of attitude on personal epistemology. We can think that if we consider this with the broader evidences we have to debate in debate, is that it promotes a different personal epistemologies, maybe more in link with evaluationist or constructivist way of epistemology, which means that debate brings to the highest level of the development of this concept. However, this analysis has some limitation. For example, I should need to focus on cross-cultural analysis, could be important. I should use different instruments, maybe more reliable than what I used, and also a qualitative analysis could be really important to understand the nuances between the different way people think and the way in which really debaters develop their epistemology. And I think that we could analyze also different dimensions, because if we consider the critique that debate face, for example, we face also the dualistic one. Okay, in debate we have a proposition and opposition. It promotes a white and black position on every kind of motion. So we can also analyze this kind of dimension, epistemic dimension. So there are roads to get a better work and a deeper work and maybe a more definitive work on this kind of questions that can help us to understand how we change through debate. Thank you very much.
Thank you. So we'll move on to thank you, Professore de Conti. Yes. And Dr. Tala, please, from University of British Columbia.
All right. Thank you all for being here. Good afternoon. I know it's been a rather busy day, so I'll do my best to keep this short. So my name is Tala Maragha. I'm an honorary assistant professor at the University of British Columbia. I'm also an assistant professor at the University of Petra in Amman, Jordan. And I'm also a dentist, which explains the title of the study, where we explored the impact of utilizing debates as an approach to teach first and second year dental students. And we looked at the satisfaction of the students using this approach and their perceived impact on their learning as well. And since this conference is all about debates, I thought we could start the summary and the research abstract slide by walking you through the debate format. So what is the issue that we have on the table? It seems anecdotally and empirically that healthcare providers, whether it's dentists, medical doctors, nurses, what have you, do not seem to be communicating effectively and critically with their patients. We're hearing more and more patients, more and more clients reporting that their healthcare providers are not giving them enough time, not validating their concerns, not listening to their needs, which entails that there seems to be a problem in the communication and the critical thinking skills that potentially healthcare providers have. Nurturing these skills and cultivating them needs to start as early as the first year of the healthcare professional program, again, whether it's medicine, dentistry, nursing, or what have you. So the solution that we're proposing is to actually implement and utilize structured debates as an active and participatory learning approach for first and second year dental students and measure the impact using a quasi-experimental design. And the outcome is not very shocking. There's no debate. Debates are actually pretty great. And we're walking you through how we got to this conclusion in a bit. What are we going to do with our findings moving forward? We're going to adopt the EEE model. We're going to expand the use of debates, evaluate them some more, and also empower more and more students, more and more healthcare providers to hopefully elevate the quality of care that patients and communities at large receive. So to walk you through the theoretical framework that guided the development and the design of this study, it's important to understand that dentists and other healthcare providers have many, many roles and responsibilities. We're going to focus on a couple. The first one is that dentists are patient educators. They're supposed to guide patients on how to take care of their health, promote their health, manage disease, etc. On the other hand, and on the other end of their roles and responsibilities, they're supposed to diagnose disease and provide treatment for patients. But in order to do that accurately and meaningfully, they need to understand the complex and the nuanced nature that the patient's cultural, social, economic background, everyone comes with a baggage. Every patient that we see comes with a baggage. So in order to treat them right, we need to understand how complex their lives are. And these two roles, whether it's the dentist as the educator or the dentist as the healthcare provider, cannot happen if that dentist, or again, any other healthcare provider, does not have the necessary critical and communication skills in order to do that. But the questions are, how do we cultivate these various skills? How to make them critical thinkers? Can we even make them critical thinkers? How do we help them communicate? When do we start? And potentially, more importantly, how do we measure the impact? How do we know whether we are successful or not? What you see here on this rather busy slide, and I apologize for how busy it is a couple of adult learning theories that were used to guide the development of the study. What you see on your left-hand side is Kolb's experiential learning cycle and Morris's objections and it's their own iterations on it. And on your right-hand side, the zone of proximal development theory. Given the limited time that we have, I'm not going to go through the details of these two theories. They're very exciting, by the way. I could spend hours talking about them. But in the interest of time, we're just going to say that in summary, these two learning theories suggest that in order to engage learners, maintain their attention, make sure that they retain the knowledge and the skills that you teach them, and make sure that this knowledge and skills kind of have the long-lasting impact, it's important to utilize active and participatory learning strategies. And to no one's surprise, debate is a very prominent and important active learning strategy. And that is why we decided to do a quasi-experiment with 130 dental students in their first and second years in the University of British Columbia. We divided them into two groups. We had an intervention groups that were debaters, and we had a control group that we asked them to write reports. And both the groups, the intervention and the control, were assigned the same motions that were essentially topics around public health, public policy, ethical dilemmas, and other topics. Each year, so each cohort participated in 2 debates. In total, we had 4 debates, and we randomly assigned them. The debating groups were on first-come, first-served basis. The sides and the teams were all randomly assigned. And what we did to collect data was that we looked at the debate scripts, preparation notes. We essentially asked the debaters to give us everything they had prepared for their debates. For the control group, we asked them to hand in their written reports, and we gave all the study participants, so whether it's the control or the intervention, we provided them with a brief survey, not very brief, that included 2 main domains. The first one was how satisfied they were as both debaters and observers, and the second one was what was the perceived impact of each method on their learning. So for those who wrote the report, how helpful was that for your learning? And for those who debated, to what extent do you think debates are helpful for your learning? We piloted that survey with 5 dental students and with a number of educational specialists to ensure the feasibility of it. And that survey included visual analog scale, so quantitative data, and it also included open-ended questions that were analyzed using a content analysis approach. And what we found was another busy slide. This is a summary of how satisfied the debating students were. The blue bars are the first-year dental students. The orange bars, or red, or what have you, are the second-year dental students. And you could see that they seemed to be most satisfied with how helpful debate was in terms of fostering a sense of collaboration and teamwork. So these are the debating students. But if we look at the observers, it seems that they were particularly satisfied with how observing a debate, watching a debate, helped them appreciate the different perspectives of these controversial topics. If we look at the perceived impact on learning for both groups, and to kind of amalgamate what this means, essentially we were asking students, to what extent do you think debates are helping you translate your research findings, because they were supposed to do some research. So to what extent do you think debates or writing a report helps you translate whatever findings that you had to the general public, to a member, a layperson who does not have any expertise? Are debates helping you send these people home with a take-home message or not? So that's what perceived impact on learning is essentially measuring. And it seems that for the debating students, they seem to think that debates were actually pretty helpful and it had a positive impact on their learning. You see that the maximum is about 90. And if we look at the non-debating student, the maximum seems to be 68. So there's a sharp drop. The reports do not seem to be particularly helpful to translate the research findings into something that a general member of the public can understand. Although everyone is provided with the same orientation, same topics, same guiding principles, same everything. Just one group debated, the others did not. And we could see that because we, in the stats, the numbers do not lie. And we can see that the Wilcoxon signed rank tests produced statistically significant results. The debaters seem to have a higher perceived impact on learning in comparison to non-debaters from both years, although the effect size is small to moderate, but we still got a significant p-value. So again, a busy slide. This is a brief summary of the content analysis of our qualitative data. We can see that as with any other active and participatory learning strategy, there are always strengths, there are always limitations. But if we look at the count that you can see on your right-hand side, there seems to be far more strengths and potential to debates in comparison to its limitations and weaknesses. And these strengths range all the way from being fun and engaging and enhancing confidence to preparing students for clinical scenarios where they're gonna debate and argue with their patients on pretty much daily basis. So where do we go from here? What we're going to do is that we're going to expand the use of debates. We can never have too many debates. We're going to expand them into different health professional programs. We're collaborating with the School of Pharmacy at the University of Petra this summer. We're running debates in the University of Petra with dental students as well this summer. We're repeating the experiment again at the University of British Columbia this fall. And it seems that Health Canada and the federal government bought into our idea. So we successfully secured 1.2 million Canadian dollars. They're not all going to support our debate project. It's a multi-phased research project, but debates are on the forefront. So we are integrating it and making it an integral part of the dental curriculum at UBC and beyond. We're going to keep evaluating the impact of utilizing this approach. The analysis is underway, and hopefully soon we will have results. And the long-term vision is to empower more and more healthcare professional students, more and more healthcare professionals to communicate critically and effectively with their patients. And again, hopefully improving the quality of life and the overall health outcomes for the communities at large. And references just because, and I guess that's pretty much it. Thank you.
Thank you, Dr. And we'll move on to our third speaker, Dr. A.Mehdi. Yes, thank you.
Thank you very much, everyone. Thank you, Chair and co-presenters. Welcome to this session, as you might have noticed, and our fourth presenter will also support this. The common thread in our presentations are the use of debates and arguments in education. And when it comes to mine, it's mostly related to educational test scores. So how do we actually use argument-based approach in order to validate educational test scores? Personally, I'm from Shiraz, Iran, and I did my PhD at the University of Toronto in Canada in a graduate school of education, OISE as it is called. And then I was back to Shiraz University as a professor. And then I got a position at Macquarie University in Australia, Sydney, Australia, and I worked there for about 12 years, where I also supervised PhD students. And 4 or 5 of my PhD students actually did their dissertations using argument-based approach to test validation. And so this is why I'm talking about it, because I'm an advocate of using argument-based. And then since 2021, I am here in Qatar at Hamad bin Khalifa University and in the College of Humanities and Social Sciences, where I teach research methodology as well as doing some admin and coordinating PhD program, things like that. All right, so basically what I'm going to share with you is that 2 definitions. One is related to debate, as you can see, which is defined as a structured, formal exchange of opposing views on a particular issue to explore different perspectives and persuade. Of course, in the keynote speaker this morning, we noticed that there could be a categorization of debate for winning and debate for agreement. But generally speaking, actually, is to come to some compromise and mutual understanding and persuasion. On the other hand, argument is a reasoned set of statements or claims intended to support or oppose an idea, belief, or position to justify a viewpoint or persuade someone based on reasoning and evidence. So in argument, we need actually reasoning and evidence. We need to provide evidence in order to persuade the other parties. Now, the implication of both debate and argument in educational assessment has been what we call it argument-based approach to test validation, which is a paradigm shift. Prior to argument-based approach, we had a more positivist type of approach where the validity or meaningful of educational assessment was assigned to the test or the assessment itself. So a test or assessment could be considered as valid and used in any context. Whereas in argument-based, actually the main argument is that this is not the case. It is our interpretation and also argument that makes a test valid or not. And based on that, in different contexts, actually, tests might have different, implications and different, interpretations. And given that test and assessment task can go from lowest stakes to very high stakes, and affecting human beings' lives, our students and also whoever actually is involved in that, it's very, very important to ensure that the decisions and the use of, the outcomes are ethical, are valid, are, meaningful. So drawing on the argument-based framework, this paper outlines how this approach establishes a chain of reasoning. So in the framework, actually, we are dealing with a chain of reasoning, articulating assumptions and inferences or claims that links individual responses or data to meaningful interpretations and uses. So I'm happy that the framework that we are using is Tolman's framework, which was referred to at least to two presentations today, which I was present in. One was in the morning keynote speaker, Professor Tyndale, if I'm not mistaken, and the other one was in the afternoon. Basically, what we can see in Tolman's argument framework, which we use as a theoretical framework, are 6 elements or 6 components. The first element or component is data, which when it comes to educational assessment, it's test takers' performance. Now, these test takers could be students, could be teachers, could be those who apply for a job and they are supposed to take some assessments in one way or another. So this data comes from any performance in educational settings. It could be at schools, it could be at universities, it could be on undergrad programs, postgrad programs. So any type of assessment tasks that are used, and the students perform on that, and then they provide some data. What do we do with this data or performance? We make some claims. Claim and inference are used interchangeably. So, for example, we claim that these students must be failed, or we claim that these students should pass and go to the next grade, higher grade. We decide to give a certificate, or we decide to deny a certificate. We decide to admit, for example, the students to an academic program, or we decide to refuse and refute, admitting students. So, based on the data, we make a claim or an inference. How is it that we can make this claim? It's because or since there is a warrant. What is a warrant in this framework? A warrant is a rule that tells us that based on this rule, actually, we can make such a inference or such a claim, right? And this rule could come from empirical research, as my colleagues actually provided, for example, some empirical evidence for the usefulness of debate, for example. Or it could be come from the literature, or it could come from different sources. But this warrant, actually, this rule needs some backing, as I mentioned, that support that supports, that rule. Up to this point, so the left side on my side, but yes, yours is left side as well. Up to this point, we can have some data, which mostly is test takers, human beings' performance, and then based on that performance, we can make some claims or inferences, and the reason, the rationale for making that claim are some warrants that has its own, backing. However, as we understand it, there could be some rebuttals. Where do rebuttals come from? Again, they come from rebuttal data, all right? And therefore, what we have decided or the decision that we have made could be negated or nullified based on the rebuttal data. Let me give you an example, right? So the data is a student's performance on a test, which turns out to be below the pass, all right? So we have set a criteria, and the student's performance is below that criteria, and therefore the claim or the inference is that the student is failed in that course or subject matter, and this happens a lot, as I mentioned, at all levels of education. What is the warrant for this? Because we said that the claim or the inference needs to be based on a warrant. The rule or the warrant is, according to educational regulations, a score below the pass level is failed. So we have made this decision and claim based on this warrant. And what is the backing for the warrant? There are studies that show there is a correlation between a school performance and future success, could be academic or job related. So because there are some empirical studies that show that if students actually perform well at a school, then in the future, if they want to continue their studies, they would be successful. If they want to get a job, they will be successful at their jobs. So the decision is based on this warrant and its backing. However, we find out that there are some rebuttals. What is the rebuttal? The student's failure on the test was not because of their low ability or performance, rather because both the test instructions were ambiguous, unclear, and also since there were some multiple choice items, for example, on the test, there could be more than one correct option. So what we decided actually in the first instance to fail a student for any reason, for moving to the next grade or certification or whatever, now becomes doubtful, because we understand that the student's low performance was not because of the student's abilities, rather some problems with the test and assessment task. And where does this rebuttal data come from? Based on the review of the test or assessment task, we find out that actually the instructions given for different sections use some very, low frequent words that the students are not able to infer and understand. And also when we check and review some of the multiple choice items, we can see that what has been identified as the correct answer could also there be another correct answer. So if a student has chosen that, then that could be, a problem. So what is the methodology when we use an argument-based framework for test validation? There are at least 4 or 5 steps in the methodology of using an argument-based in order to validate educational assessments. The first step is to define the interpretive argument, because the argument is an informal logic or uses an informal logic, and therefore we need to come up with an interpretation and clearly articulate actually the proposed interpretation of test scores. What are we going to make out of these test scores. For example, if a test is designed to measure a student's readiness to college, then we need to provide clear propositions as what makes that. The second step is to identify the warrants, as we discussed before. And the third step to gather evidence, so collect performance on the students' performance on the test. And the fourth one is to evaluate the evidence, assess the quality and relevance of the gathered evidence, which are either supporting or negating. And the final step is to come to conclusions. Okay. I have an example and a scenario, but it seems that I have only 3 minutes, so I skip that. And I just go to recommendations. So there are some recommendations for different stakeholders. The first one is educational assessments are used for different purposes, and also sometimes they have some high stakes, and therefore we need to be very careful about the decisions, the interpretation of the performance, as well as the decisions that we make based on the outcome of the test performance. And interestingly enough, argument-based framework provides a robust and coherent framework with 6 key components or elements, as I mentioned. And when it comes to reality in real world, then we need to gather all types of quantitative, qualitative, data and analysis in order to be able to support the claim or the inference, or on the other hand, to consider, the rebuttals. To use educational assessments meaningfully, educators and test developers must go through a systematic procedure of building an interpretive argument, identifying propositions, gathering evidence, evaluating evidence, and drawing conclusions or making decisions. And therefore, I'm an advocate of using argument-based approach to test validation. Thank you very much.
Thank you, Dr. Mehdi. And now our final speaker is Dr.
Almutazbellah. Oh, thank you so much, Professor Boulos, co-presenters and esteemed attendees. Thank you for your patience, so please bear with me, and we're going to make it to dinner on time, inshallah. My name is Alabd. I'm a lecturer of Arabic and Islamic Studies in Chicago. And my research and the story of my research study is basically about the use of debate and its impact, or if it has any influence on our Arabic students' performance. So students who study Arabic in Chicago area. And my sample for that research basically was 42 students. And those 42 students were among the heritage speakers of Arabic. I would rather translate this into Arabic as متعلم اللغة العربية كلغة موروثة, not لغة تراثية, because the term تراثية basically takes minds to the classical language teaching. Or I would rather say متعلم اللغة العربية من أبناء الجاليات العربية والمسلمة. So that's basically the type of students. All of them were senior high school students, and their level in Arabic language, according to ACTFL guidelines, it is advanced low to advanced mid. So that was the level of our sample. Basically, we carried out a lot of research, a lot of work, and I had 3 groups of students. The sample has been divided into 3 groups. The group number 1 is called the traditional one. So they study and take questions and respond to them in the traditional way. The second group is called the presentational group. So they are expected, whenever they study anything, to present it in terms of writing and speaking. So speaking, presentational speaking and presentational writing. And the third group, and that was the added element, is basically the debate-based group. So they are expected not only to present, but to argue and take a side when it comes to speaking and writing. My research was focused only on the skill of writing, so I would see if there should be any differences in the productivity of our students, basically testing the word count, how many words they are able to produce and in a writing assessment or task, and the lexical diversity, to what extent they are able to use old terminology or even use untaught language in the classroom, as well as the use of the taught language. And last but not least, the complexity of their sentences. So basically, my research taps into this area of second language learning, heritage speakers, and also debate learning. So that's basically, and it gave a lot of insights, basically, that should be reflected in our use of debate in the classroom. So theoretically speaking, as I just mentioned, our research and my research, it taps into the framework of debate-based learning, also the heritage language education, the actful proficiency, guidelines and teaching, and the cognitive engagement. Part of the study also was to test the students' motivation, the students' attitude toward the three methods: traditional, presentational, and debate-based, and also the socio-affective learning factors, as I just mentioned. So these basically were the theoretical frameworks beyond my research and where my study taps into. The methodology of the research, basically, it's a mixed method approach. So I carried out that study toward the end of a whole semester of teaching. So I had three groups of students, as I just mentioned. All of them were equals in number, so I had 14 students in each group. So the traditional method, as usual, the presentational, and the last one, which is the debate-based. And then also I carried out a survey and a questionnaire to survey their attitudes, to survey their motivation, their perception, and even their preferences and what they recommend the most. So that was basically the methodology and the assessment tools I used. What is more important here is the research results and the outcomes of that research. I tested one variable, which is the word count, and that's quite important and significant, and you may see like the big differences, like the average of a student doing on writing. Basically, as I just mentioned, it is the writing skill. So when I tested that, the average was like 232 words in the debate group compared to the presentational 177, or even the traditional 163. So you could see the big gap between the three groups, and it's all in favor of using debate. Another variable, which is the lexical diversity, which means untaught vocabulary. So I would even scan and I see if there is any language that we did not teach in the classroom specifically to that. And the room is open to analyze here where this language came from. It could be all the language. So the speaker or the student is able to recall their old knowledge. Not only this, coming up with untaught language that we did not even teach in the classroom, and we may even expect that the student did not study this type of language before. So this means they were independent in their learning. They were looking for words. So when we look to like lexical diversity, you could see the big difference. The average of a student in the debate group would come up with 15 new words and expressions that have never been taught in the classroom. It could be recalled from the past or never been taught before, compared to the presentational that were able to come up with almost 6 new words, and the traditional group 1 or 2 words maximum. So you could see the big difference and the impact of debate on even the presentational writing of our students. Another variable was the sentence complexity. In the traditional group, when you give a Q&A, basically students write very simple answers. So where did Ali go? Or why Ali took that position? Because Ali sleeps early, or because Ali wake up early, and that's it. So the sentences were very fragmented, were very short. But if you compare it to the debate group, basically, you could see more complex sentences. So there is a kind of correlation between the word count and even the complexity of sentences. The debate group they seem to give more complex sentences, more extended, I would say, run-on sentence in Arabic sense, which is not necessarily negative, as we say run-on sentence in English, because the sentence in Arabic could be as long as you can, but that has been noticed more in the outcome or the production of the debate group. So we expect at least 8 sentences of complex sentences, compared to the presentational group about 5 to 6 sentences. And the least, of course, is the traditional method that would give 3 to 4 maximum of complex sentences. So that's also one of the variables that we tested in that study on the skill of writing. The affective factors, and basically that was talking about confidence, how students feel confident doing a job or carrying out a job, their motivation, and which one, and their engagement in a task. When you give a student a task or an assignment, how engaged they are across these 3 levels. And of course, it was also in favor of the debate group, with some, just like when it comes to motivation and being challenged to do a job. So it showed also that students would recommend the presentational way, because when you ask them to make a presentation or to give a presentational speaking, or to ask them to make a presentational writing paper opposed to a position paper, so instead of putting them in a corner, you give them the freedom. So they said, yes, in the presentational task, we have the freedom to say whatever. I don't feel that I am in a corner. Keep in mind, the debate group, when I assign them to do a task, you have to take a side, either with or against, and you argue how. And that's how, although they don't have the freedom to speak about the whole topic without taking a position, they now take a position which minimizes their room, their chance to come up with, let's say, unnecessary information, because they're gonna argue or defend a certain point of view. However, despite that, they were able to come up with more statements, with more examples, with more debate terminology used that we have taught, or even from outside, because that's how the situation sometimes, and it's also an area for research, it is like borrowing or transferring from the mother tongue for them, which is or the host language, which is English. So you could see even that students coming up with some expressions, and they translate it into their minds into Arabic language, and you could see, or you can just hypothesize that this terminology comes directly from the English jargon of debate. So that were basically the variables that we worked on, and it was all in favor of the debate group, and it shows the implications, and it shows the importance and the significance and the impact of using debate within our classrooms, and basically about the skill of writing. Our research recommendations, like all of these insights, would highly recommend that in curriculum building, we highly encourage the integration of debate-based learning and elements, because it has its own impact, and it could, as you have seen here. Also, one of the recommendations is when it comes to teacher trainings and packages, it's quite important that the teacher should be qualified and able to teach their students and to run the classroom mode. It becomes even from the selection of topics and how to make our classroom debatable in a sense, and that's quite important, and it's a great influence on our students' performance and learning. Also, as you could see, my study was a short-term study over 1 whole semester, but I highly recommend if it could be a longitudinal study, at least over a whole year. Also, the sample that we used, it's a very small sample, like 42 students is not a big number. However, it gives us a lot of insights, and it gives a lot of information that we can build on. But I highly recommend that in the future we can make it a longitudinal study to better measure the impact of debate. And we mentioned also the large sample size. Also, we need to focus more on the socio-affective variables when it comes to motivation, when it comes to attitude, when it comes to all of these elements. It's quite important also to test that and to verify the results, because the outcomes of like your attitude, your motivation, your engagement level was basically based on the students' input, which is not enough to judge and to generalize any results, so it needs more verification. So I think more information should be there. We also recommend that speaking proficiency, as I just mentioned, my research was based on the skill of writing. Actually, I collected a lot of data for speaking as well, but I didn't have time to analyze that and have it published, so I was hopeful that I got the I get the fellowship. So inshallah, maybe next time, so we can extend that research. And basically, that was the initial intention, by the way, just to make it on the speaking, presentational speaking and debate, but it needs a lot of work. So I found it easy. Let's do the writing right now. So I modified my study in a sense, and I ended up doing it and analyzing it on their writing skills. So basically, I think in the future, the next step for myself basically is just to go ahead and work more on a longitudinal study with a big size sample, and also make sure it is on their speaking or debate skills as well, because that's quite important. The other aspect of productivity, the listening comprehension as well. There was no room in our research to test if debate has any impact on their listening skill. Critical thinking and analytical skills, as we just mentioned, yes, students showed that it's more critically pushing, and just like I can be more critical thinker in that task than this task. But again, that's not enough. We need to test this more empirically. Reading comprehension as well, if it has any impact on their reading skills and research skills. So the integrative communication and collaboration, all of these are areas for future research. But just to conclude, as I just mentioned, these were basically the outcomes and the variables I did work on using only one skill, which is the writing skill for that small sample of students, and the outcomes when it comes to word count, when it comes to lexical diversity, and when it comes to language or sentence complexity. All of them were in favor of the debate group compared to the other two groups. I conclude with this, and I would like to thank you so much for staying. Thank you so much.
Thank you, Dr. Mutaz. Please join me in just thanking our four speakers together. So we have time for questions. We have a fair bit of time, and just noticing that constructivism lives, I think. But I think the corner there, and then you, and then you. If you have a specific question for a speaker, please identify the speaker or to the whole group.
Hey everyone, so thank you so much for these fruitful presentations. My question is for Tala. So basically I have two follow-up questions. Basically when we talk about, if we were to implement this paper and like implement it into a really larger group than what we already did. So basically when we talk about the medical sector itself, we're talking about people who are already close to burnout, or people who are already pressured, or people who are like already have a lot on their plate and also have their own package. So basically what I'm asking is like, aren't like implementing this paper putting more pressure and opening the door of like just enhancing the possibility of burnout throughout like the dental students or like medical students, or if we were to implement it also for other sectors in like medical studies? And the second question is, like, it's also a follow-up from the first presentation. Wouldn't like introducing doctors to debates turn their mindset into a superficial mindset where they just want to win an argument when it comes to their patients, and at the same time, when it comes to consultation with their fellows and like peers, doctors, when it comes to, like to critical conditions, even if they're not right in that situation, but it's only about like winning that argument?
Thank you. As a dentist, I only speak for myself. I can assure you that this is the case indeed, and it is all about winning an argument. The status quo is about winning an argument right now. And again, I only speak for myself. But on a more serious note, I completely agree with that. Actually, part of my PhD looked at well-being. And I think the question here is, are we adding more, or are we revisiting some of the traditional approaches and maybe having debate replace them as an alternative? So I guess I truly do not have, it's a very good question with a very fair point, but I do not have a really solid answer for it, except to say that there is room for experimentation. The medical curricula, the dental curricula has not changed in more than decades. I think we're talking about, we're getting really close to almost a century. So it is about time that we start shifting things around, but it is 100% a possibility. I acknowledge that, and I do see the value of that. I will have to say that anecdotally, I don't have data on that, but the students are, my students can be pathologically competitive. So it even gets them more excited, more motivated in comparison to other teaching methods. But again, that's only anecdotal. I don't have data. They could be worn down 100%, which is another area to explore. But yeah,
exactly.
Sorry. That was very elaborate.
Yeah, thank you.
I'm wondering if Professor Conti has something to add to that question.
We shown to be humoristic. We shown that they are not simplistic. So, but okay, I want to add something. I think that I see when I research on evidences on debate, and it shocked me that many evidences relates to care activities and disciplines. And I ask myself sometimes why they have need to debate. But in some context, I see that, they have to talk with the parents, they have to talk with the patients, they have to face problems and incompatibilities which debates help to face and to manage. So I think it's, in Middle Ages disputation were done in medical disciplines too, and maybe even today we need that. But it's okay. However, to answer in another way, it depends how you train your students with debate. They are not. They do not. Okay. The aim is not that to win. It's just a frame. It's a game. The way it's not to win, above all in didactics, I think they do not focus on win, but they acquire a lot.
I think we have right here, yes.
Hello. Thank you for the presentation. I'm sorry, I'm terrible with names, so I'm just going to refer to, the numbers presenters. So I have a question for the second presenter and the fourth presenter. So for the second presenter, so I also like part of my area is also in kind of pedagogy or assessment in higher education related to healthcare. So I hope you understand this is where my question is coming from. It is an interesting topic, but I'm just wondering so for your control group, you're sort of assessing, or for the control groups, is the design is based on like a written type of assessment. I'm just wondering why isn't the control group to be based on something kind of more, at least the format or the skills being assessed kind of lies more closely to what's being assessed in debates. Because for me, like the format of debate itself, kind of mirror more closely with what you want to with patients, interaction later on. So I'm just wondering why isn't it designed to be something on debate itself, and also another assessment method that maybe follows the same reasoning pattern and stuff. It's just taking out the format of debate so that you can be sure that it's really the form, using debate that is having a positive impact in students' interaction later on. So this is my question. And then I have some questions for the fourth presenter. I find it very interesting. I quite enjoy the presentation on the topic. I think what I was wondering is, I think it's more like a discussion, because I was looking at the things that you were measuring, and then to understand the formal debate on students' learning. But I'm just wondering, when you're analyzing data, does different kind of formats in the classroom influence the correctness of people using language? Because I will find that very interesting, to know. Because for me, the traditional method, Q&A, I guess as an instructor, you can, if students, is using language in an incorrect way, you can give them immediate feedback and then probably correct them. But when I, for example, use presentation or debates, with my students, and then sometimes because I don't want to interrupt the flow, so I would just let them go, and then even though maybe they will say something wrong or use grammar, in an incorrect way, but I wouldn't do anything. So I'm just wondering in your results whether this is, I don't know whether you find anything interesting. And then I also find it interesting that in your recommendation that you want to encourage implementing debates, but I'm just wondering, can you say a little bit about the level of your students? Because if they are, I don't know, in the beginner level, I assume it's going to be harder for them to do debates. I'm just wondering if you have any kind of reflection on the proficiency of students to implement debates. Thank you.
Thank you for the question. I think I need to clarify a few things. Sorry, and that's completely on me. This presentation is a part of a larger study. So I understand how it may seem like comparing oranges with apples, right? Like written reports with spoken word, but that's what I was measuring is the development of critical thinking, which is not at all part of this presentation. I did not assess communication skills or compare them between the report group and the debate group at all. It was simply just a self-perception type of thing. Do you think that debates has improved your communication skills, period? So that was not formally assessed. That was not part of the experiment. What was part of the experiment is the extent at which they were able to develop their critical thinking skills. For that, I analyzed the scripts, not the debates themselves. So I had it recorded, and then I transcribed them, and then I compared both to eliminate the whole communication part, right? Because if you're looking at the way someone says something, it's way more convincing than reading something. It can be more convincing. So I completely understand. But sorry, it's on me for not clarifying. The communication part was not part of the experiment. The critical thinking development and assessment was what was compared, and it was purely on the transcripts. The spoken word did not have any impact on it.
Thank you so much. If I should begin the answer to your question, I think the last part when you mentioned and we talked about the level of students, of course, our recommendation to use debate and debate skills and the toolkit within our classrooms, basically it's based on the proficiency level of our students. So the sample I used, it was basically on ACTFL guidelines, and according to ACTFL proficiency levels, it was advanced low to advanced mid. So basically that was the level of our students. How did we do that? Basically, we have a dual credit class at high school in Chicago, and basically that's a college level course. But because our students are from heritage background, which means from Arab and Muslim background, so they have a higher command and advanced command of language. So that's one thing. And the other thing, they have a proficiency test they take before joining that dual credit class. So that's basically the level of our students. So we highly encourage that, and it should be clear that, of course, for higher levels, starting with advanced low to advanced mid. Maybe in the future, research could prove, yes, it could be presentable to even intermediate levels or even novice. It depends, but I don't have any research data at the moment to argue for that. That's one thing. For the outcomes and the results, how to verify that these results would reflect basically, I mean, across the traditional method, the presentational method, and the debate method. I mean, the assessment was like in a freestyle that each question, the Q&A for the traditional method, for example, okay? So the test, they all studied the whole content and the whole topic, and let's say like the sample of testing, they took the same thing, but each group within their own respect. So the traditional would respond without interference on my side, and the presentational group, just like they do have the question and they respond as expected based on their understanding of the question presented. And also the third group, the debate, where you guide them just like you take only a position and then you argue for that. So there was no limitation at any point that you could not exceed that. No, it's a free writing, so they would write. And basically when you give a feedback, of course, feedback has a strong impact, but all groups have that feedback. But I mean, it was about productivity, not the grammatical correctness of what they presented. Even the sentences, you see to what extent they are able to express themselves and not to what extent they are grammatically correct. Okay, so the sentence itself, I would count that sentence and consider it because I could understand, I could elicit what they mean here, even if it's not grammatically correct or sentence is not complete as we talk about. However, and that's also a room to argue, I think, and a room to research their grammatical correctness and to what extent their sentences are complete or close to native-like. So I think that's also an area of research. Hopefully I could just touch base on that and just to clarify that position.
Oh, sure.
Thank you for the question, because I talked about educational tests. So one of the uses of tests is in research, especially in experimental designs, because we usually have pre and post tests, and then we compare and find out to what extent the treatment that we have used, which in these cases actually has been debate as a pedagogical instrument, have been effective or not. And then based on the outcomes of the test, we make inferences or claims that then that could be used, or we make recommendations to different stakeholders, including other colleagues who are teaching and other courses, or policymakers or other things. So again, this brings me back to the importance of making sure that the tests that we use, in this case for research purposes, they are valid, meaningful, so that the claims and inferences that we are going to make out of our data and analysis, then they could be reliable and valid. So this is another aspect of
Thank you. And I think we have another question right here.
Thank you for all your presentations. I have a question for the fourth speaker. Just for better understanding of the baseline of the study, on what basis did you distribute the students among the three experimental groups?
Yeah, that's a good question. And by the way, just keep in mind that those students, even before doing the sample and putting them in that sample, it was a random, without just like selecting or just like, but keep in mind that those students have been through the traditional method, perhaps their whole journey of studying. They have been doing the presentational method most of the time as well. So the new element, the new added element was the debate part for the selective group. So basically it was just a random selection of students, and it could be also part of the limitations of the study as well, but it's not a guided work, so we could not interfere. I want to make sure that, so making it random was the best option for me.
Thank you. Question over here.
Yes, I have a question for Manuel. I want to know or understand better what are the implications of having a specific personal epistemology. Like, what are the implications if you have certain way of approaching knowledge, like.
Okay, thank you. Having different personal epistemologies relates, for example, on the way you weight evidences. There are some stages or some there are some stages of personal epistemology or dimensions, for example, dogmatism, that restrict the way in which you analyze evidences. Also, relativism make sometimes evidence not useful at all. So it implies, above all, among other things, the way in which you analyze evidence and the way in which you consider knowledge is knowledge derived from evidence? Is knowledge something everyone have and think about, and everything goes as it is for a relativist, or not? And this is something that change in the kind the dimension of epistemology. But okay, if you also you can also understand if that knowledge is something me and you construct. This means that okay, I have a different relation with you, rather than considering that knowledge is given by an authority. And also the way in which I process knowledge changes the way in which I think myself and my path to learn. Because if I consider that knowledge is given by the authority, there's one way in which I develop my learning. If I think that knowledge is something we can construct, I have to develop my position and relate with others, being open. So it relates a lot with the many dimensions of personality, I think, as some other theorists say. Thank you.
I think we have a question over here, but I'm going to exercise chair's prerogative here, and then my suspicion, esteemed guests here, is that you're preaching to the choir in some sense of constructivists. So let me just follow up on that and challenge, and maybe this can come out in the next question. It's one thing to be a constructivist with respect to learning theory, which I am, but I am anything but a constructivist when it comes to epistemology. And I think we need to be careful that we're mixing epistemic states, because a role of argument might be to get someone, if you think about argument, in fact, if you think about teaching as manipulation, that's what we're doing. You were the only one who talked about an ethical concern here. We're manipulating students, right? So I'm just pushing back on all of you to think about the learning theory that you're trying to, within which you're saying debate is a high impact instructional practice. Thank you, John Dewey. Thank you, Kolb. Thank you, proximity theory. But at the end of the day, we want dentists to know how many teeth are in the mouth. I was 58 before my dentist realized that I had an extra tooth. Okay? So that's knowledge. How we get to that, I think we need to be careful. But yeah.
I need to re-answer and I say, I think we are lucky to have a different position on how a person could be cared. And this, okay, it's an answer.
I think this was a language issue for us. Sure.
All right. So first of all, thank you so much for the sharing of practices of debate in education. And I'm very excited to see how debates have been applied in different levels of education as well as in a different discipline of study. My question, it's rather not a question, but I would like to know, in the course of you applying debate as part of your pedagogical approach, if you don't mind any of the four speakers to share, what kind of limitations did you face in implementing the debate? Because it wasn't really clear to me just now in the presentations as to the specific format or debate structure that was used in your pedagogy. So if you don't mind sharing, just for the comparison purpose, because I'm also practicing it in my teaching approach. Yeah.
So in the spirit of time, do you all want to answer this? So why don't we just go back like this and maybe just answer what model of debate you used, and then you can choose whoever you later informally, how did you do it, okay? So parliamentary debate, competitive debate, all that sort of thing, right? What model?
Yeah, in a nutshell, my style was just like Qatar debate style that I've been through in the past 5 years in terms of adjudication, in terms of training. So that's basically the model I used. And as I told you, one of the limitations was just like to the students' command and their ability to perform in speaking. That's why I rather went to the writing. So writing was easy for me, to be honest. I think the challenging part would be in the future to work on speaking. Thank you.
And the model that we use in our studies is number one, Tolman's model argument framework, which I mentioned, but based on that, Kane has developed specific models for educational testing and assessment. Kane from educational testing service, but then it's very popular.
We just use competitive style WSDC format.
Okay, I world schools debate, British parliamentary, but for teachers also a modular, it means teachers have to use the rules that make their educational needs to be met. So they can change also all the rules of the debate. I think that debate has many blind spots, and we have to talk about that. It's very important. One of these, I think that other form of interaction make people more critical and more, more critical without a stance, but nothing more than debate for me promotes argumentation.
The last question.
Yeah, thank you. So I'm directly addressing my question to the fourth presenter because I came halfway your presentation. I could see that you said students transferred or carried over some debate strategies from English into their Arabic. Did you observe this through their reflections and interviews, or did you find any manifestations or realizations in their writing to prove this?
Thank you so much for the questions. That was something extra that I added that but it was not part of the research outcomes. I did not report on something like that, but because I need to follow up to see where it came from, but I just hypothesized that it came from, it's a transfer from the mother tongue, just like, like someone passed away and they come to you and tell you in Arabic, ana asif. So ana asif in Arabic doesn't make any sense within the context of someone who passed away. You don't have to apologize for me for someone. So for a second, that's a transfer from their mother tongue. That's basically, but it's still a subject of research. So I made references to this in my presentation, but basically it was not a subject of research. I think could be in the future as well, and to see if there's any influence or transfer that happens from the host language or mother tongue to the second language being taught. Thank you.
Thank you, and I will not be fired because I've kept us to the hour and a half. So thank you, everyone. Please join me on wonderful presentations and a great way to end day one of ICDD 2. So thank you, everyone. And thank you to the audience for great questions.